Hey, Dr. Bryce Lee with Strength Space and another frequently asked question. And this one is it safe to strength train if we have osteoporosis? Well, we already know from general health guidelines from the American Medical Association that strength training has to play a crucial role in any program to manage osteoporosis. And the reason is that even if we're taking medication or supplementing, we need some signal that tries to convince the body to build denser bones. If we want stronger bones, we have to load them. And so what we need to think about is, how does our body respond to stress in general? We could think of many examples where the degree or the dose is what determines whether something is therapeutic or dangerous. Sun exposure can produce a tan and stimulate our body's production of vitamin D and nitric oxide, which are very important for our cardiovascular health and immune function. But it can also produce a sunburn or cancer if we overexpose. Friction can give us calluses in our hands, which makes our body better able to cope with stress and deal with loads in everyday life. But too much of it can also cause a blister. So what we need to figure out is how to dose strength training correctly, not whether to do strength training, because that question really has been answered. Strength training is a requirement for the management of osteoporosis. When we think about how to perform it, we want to think about a very simple equation from high school physics, which is that force equals mass times acceleration. If we want to move loads that we know can stimulate bone density, but we want to move them in a way that is low force, we want to think about keeping acceleration to a minimum. And when do we really experience acceleration? When we change directions. And so if we're moving a load and we change direction slowly and carefully, not unlike you might try to carry a tray of beverages and not spill them, when we move in that way, we can keep forces very low, even if the loads are heavy enough to stimulate our bones to grow stronger. If instead we're thoughtless about our pace and our tempo and changes of direction, and we bounce, yank, move suddenly, we come down with the load and bounce out of the bottom hard part, that is where the risk is. And so that's why at Strength Space, what we do is we cue and coach religiously to make sure that our changes of direction are slow and gentle, so that even if the loads are pretty substantial and beneficial for producing strength and muscle mass and bone density improvements, because we change direction with great care and slow tempos, what we can do is keep the forces low enough that they're very safe. And it's not unlikely, it's actually quite possible, that even when we're lifting heavy loads with our legs, the forces that we're experiencing are less than we might experience just walking down the stairs or stepping off of a curb. So we can have a lot of the benefits, we can have our cake and eat it too, in terms of stimulating stronger bones with meaningful loads in our strength training, but we can do that in a way that is safe when we learn how to behave and move slowly with a controlled tempo. So that's what we do at Strength Space. That's what I encourage you to do with your strength training. Make your strength training as safe as possible by controlling the way you change direction, controlling your tempo, so that you can stimulate your muscle tissue and bone tissue to grow stronger without unnecessarily increasing your risk. I hope that's helpful to you. Please stay tuned for more frequently asked questions. Again, I'm Dr. Bryce Lee with Strength Space.